So that's not really, what we need are tracts. And what are the tracts that run in the inducium griseum above the corpus callosum?
Medial and lateral longitudinal striae.
300 marks. Medial and lateral longitudinal stria. Medial and lateral longitudinal striae. So from the hippocampus and the dentate gyrus, the white matter that leaves, the tracts, are the medial and lateral longitudinal striae that will take you right round to the septal area. Now there's a lady called Neandra. Neandra's septal area is composed of two guys, one here and a little one more anterior. What are those two guys known as? Septal area has two guys. See that? Septal area has two guys, two gyri. What are the name of those two gyri? Two gyri, one in red and the other in green. Right? And it comes in the exam all the time. Two gyri. What are those two gyri? Let me give her one last diagram here. Alright. So, this is the corpus callosum here. That's the genu that comes around. Genu becomes attenuated to form what? Rostrum, which now will continue as lamina terminalis. And in front of the lamina terminalis there are two gyri. Okay, so this is lamina terminalis, that's rostrum, that's genu of the corpus callosum, and they are called what?
Para-olfactory and para-terminal.
Para-terminal and par-olfactory. And that whole area is called the what? Septal area. Alright? This area is called the what? Septal area. This whole zone is called the what? Septal area. So the septal area is getting input from primarily stria terminalis, isn't that so? Diagonal band of Broca, very good. Alright? Septal area also gets olfactory input. What, Jonathan?
Pardon?
Septal area also gets olfactory input. Via what?
Medial olfactory striae.
Medial olfactory striae. Alright? Septal area is also known as what part of the brain, Julian? Pleasure zone.
Yeah.
The what zone? The pleasure zone. Very good. Alright? Pleasurable stimuli. That goes to the area called the septal area. And the main output of the septal area is known as what? The medial forebrain bundle that takes you to where? Today? Hypothalamus. Very good. Now, or let's just do some general things. Not general things, but specific things. So see the pin, let me put the pin back where the pin is always. See, I'm trying to put it through the exact hole there. Now this question is, so I'm asking some small things, then I'll go on to bigger things. Very good. So we'll ask some small things and then big things.
I'm going to take picture and show you. Well, the line thing and you ask for it before.
The retroflex?
That's before.
That's that?
No, that's what comes before that.
I don't know.
Very good. So Andrew, where's the pin in now? Come and look over here.
You want some juice?
Here, come, let the man in.
I have some on my finger.
Just hold it. Yeah, man, and do that if you want to wash your hands, do that basin. Very good. I want you to look hard at the thing. Harder. Right? And it's a structure that's running on the thalamus. And it's leaving the septal area. This is all
The three
under.
things that some
This
people
is all
say,
limbic,
and I ask you.
leaving the septal area.
Thalamy.
And these little bands are called in the brain stria. So this is stria medullaris thalami. Stria medullaris thalami. Going to where? Habenula. So if you trace that structure back, Andrew, that will take you to the habenular nucleus. And the main output of the habenular nucleus, the answer you know. Fasciculus retroflexus. Main output of the habenular nucleus is fasciculus retroflexus. Good handle. Fasciculus retroflexus. So we must put it in the what? In the habenular nucleus. So there. If you come right back at the end where it ends, the structure ends in the habenular nucleus. Okay? The structure is going to end where? In the habenular nucleus. Okay? Okay? Now, let's do something easier. Alright? More. So let's go get to more general things. That was we sort of went off into some very specific things. Let's do general things. And this general question is for
Rana.
no? What's the man in it? What's this gentleman here?
Andrew.
Andrew. Very good. The question is for Andrew. Andrew, mean a friend. Mean a friend. So this is what? What are we dealing with now? General things.
And generally,
This
don't
is
put
not.
people's faces.
This is the core information. We're not out at the periphery.
What is it?
Core things. So what you need to ask yourself question is, what is the pinin? And the pin is obviously in the inferior colliculus. So what's the afferent to it? Lateral lemnis stress. Part of which pathway? Auditory. Part of which pathway? Auditory. Okay? Part of the auditory pathway. You must know about the auditory pathway. So there will be models in the exam, 100% so. And Dr. Shetty's favorite question is, Cus communis?
What?
What is his favorite question?
Posterior.
Cus communis. It comes in every exam for the last
Anterior and posterior.
many years. Every year it's there, Cus communis.
Fuse
So
anterior and
therefore you
posterior
need to look at a model of your semicircular canal.
Semicircular canal.
Can I give you another one? Ductus reunions. Very good. So we must know on the model. So you have to get a picture of the semicircular canal. What do you want to look at? Ductus reunions and Cus communis.
What's Doctor's email?
Ductus reunions is the
Doctor's what?
from the
Very good.
fuse aspect of anterior and posterior semicircular canal.
So we must know about what
Reunion.
Cus communis.
Ductus reunions is the one from the
Then Andrew,
saccule.
listen to me. You must know the
Ventricle and the
details of.
Let me see.
See the connection.
What do you think
This
all
and
this
this.
is on the exam? Pinna of the ear.
Between the cochlea and the
One special station for pinna of the ear. Sensory innervation,
to the pinna.
blood supply, lymphatic drainage, and all the little things on it.
The pinna of the ear.
Simba, this, that, Skyfer, all sorts of things, alright? So every little region, every little thing, all of those things you have to know. What do you need to know? One entire station on pinna of the ear. Alright. So you can inform the general public. Pinna of the ear. Very good. And you look at the model and make sure you know Cus communis and Ductus reunions. Very good. Alright. We just have info.
Saccule and the
So the
cochlea.
auditory pathway
And what?
Cochlea.
begins in some little hair cells, isn't that so? Very good. You need to know scala vestibuli, scala media, scala, all of these scala we have to identify. Right? And all those cells are there. Wait a while. Hold on, I'm trying to think for you. So don't put me off. So make sure, no. The cell bodies for the first order neurons in the auditory pathway are located where, Jonathan?
Vestibular ganglion.
Vestibular
Whoa,
ganglion.
sorry, cochlea. Sir, you have to understand.
See, I wasn't too bad with Stephen yesterday.
No.
Alright, so you see, he's forgiven. I'm mixing up Stephen. So what is
So we're
it?
all getting old here.
Very, very good. So it's located in what?
Spiral ganglia.
spiral ganglia.
Yeah,
All right? And then travel with the cochlear branch of the vestibular cochlea to the cochlear nuclei, and the cochlear nuclei look around the inferior cerebellar peduncle. The ventral fibers pass in a structure called
Trapezoid body.
trapezoid body. All right? And then they are dorsal and ventral coming from the cochlear nuclei. And these feed into the superior olivary nucleus. And then ascend in a structure called the what? Lateral lemniscus. Okay? So the lateral lemniscus usually is in the exam too. So, there. See it right here? Excellent. So Jonathan even knows exactly where it is. There. See there? So pass it around. This structure is the what? The part. That's the lateral lemniscus. Part of the auditory pathway connecting the superior olivary nucleus to the inferior colliculus. Alright? And then, look how many times they've asked this in the exam. It's all mashed up now. The pin is in it here. There. And that's the inferior brachium.
What the heck?
That structure is a what? Inferior brachium. And that inferior brachium, as you can see, is going to go up to a structure called MGB. Structure called what? MGB. And from MGB via the auditory radiation, right? Watch here now. Look at this specimen right here. There. So. Alright. Now there's a lady here. She's my good friend and the name slips me, but not a good story. Neil? What's the little lady? To your left. Not to your left, to your right, sir.
Rana.
What? It's Rana. Rana, how could I have forgotten?
Good question.
No. You're right. So Rana, where is the pointer here? Oh wait, it's not a good story.
No, it's
Rana's
not.
there. Rana is my good friend. Very good, and I forgot. So Rana, where is the pin there? So Simpson, where is the pin? That's very good. That's the superior temporal gyrus. That's the what? Superior temporal gyrus, and the middle part of it is what we get called what? Heschel's. What's that? Heschel's gyrus. Very good. Right posterior to Heschel's gyrus, what's the area called?
Planum
Planum
temporal.
temporal. Very good, very good. No, this is a good one. There. There.
Let me catch it quick, sir. Oh. Yeah.
External.
Ibrahim, that is the
External
external
medullary
suit.
lamina.
What goes through there?
Corticus.
Corticus striate. Alright. Okay. Very good. Excellent. So this is all the tentorial surface. That's all going to be supplied by. Now this is Dr. Thomas's favorite question. There. Alright. Every practical is there. See it? It says, Dr. Coops. Very, very good. See what you're saying. Thanks, man, Coops. All is good. You can read them right here. See. Many, many thanks. Very good. Excellent. We're all right, see? All right. Good. Thanks, everyone. Yeah? Very good.
Oh my god.
So,
Yeah, man, big up Bassa. Every single time.
no. So, what's actually supplied there? And I told you in the lecture.
Oh, yeah.
Yes. Ibrahim, what's the name of the artery? There. Coming from which? The middle cerebral. Lenticulostriate. Alright. Every practical there is the lenticulostriate. That's coming there.
Yes,
So, John, you can give some of these people the pictures.
Yeah, man, yeah, man.
You can give this
So it takes time.
You can give this gentleman.
Yes, it takes a very long time. Yeah, when I go home, I will do it. Instead of sleeping, I call it.
And from the lab.
It take forever.
What is that? That's special, right?
This?
No, yeah, this is like divided by like, so why is it thing? What's
That
that
might
one
be-
thing?
Yeah.
From your-
So this is the wall. So
Down here would be a combine.
Yes, wherever the cardiac and the
Is the lenticular stride, which is coming from where? The middle cerebral. Jonathan, they're giving you a hard time.
No, man, I'm good,
All
sir.
right. That's the lenticular stride, all right? No, this question is just a simple one. Nothing hard, nothing too bad. Arterial blood supply. Julian,
Me.
because you're right in front of me, right here. Very good.
Probably want to get that.
Man, this one has some large ones, Jonathan. I never seen them like this one. Look how large these are. Watch here, look. You see how large they are? Look at that. Ooh. Big.
Yes, sir.
Daniel, you observe? Very good. Your feet.
Is that a facial
What
cardiac?
are they? Very good. These are the gracile
Whoa.
tubercles.
Okay.
Totally wrong.
These are the what? This one is what? These are the what?
Me too.
Gracile
Yeah,
tubercles.
exams.
Very good. They are big here, aren't they? They're large.
I want to slip my
Involved with what?
short color.
Which sensory input?
Proprioception, vibration, 2-point discrimination.
Very good. Where the cell bodies for the first order neurons in the body?
DRG.
Dorsal root ganglion. Cell bodies for the second order neurons? Right here. In the gracile and cuneiform nuclei. But this four is no. So that's massive. Look at that. That's big. These are the gracile nuclei. Tubercles. Okay? Alright? There's a man named Andrew. Andrew, what leaves the gracile tubercles? The gracile nuclei. So going up are the fasciculus gracilis and cuneatus. There's synapse there, and then leave us which fibers? You alone. Not hard, man. Just think. Think of the proprioceptive pathway. From the gracile and cuneate nuclei, what do they leave us? And they go like this. Go like that. And then they very good. And they're going around in an arc. They're going around in an arc. Internal arcuate fibers. So from the gracile and the cuneate nuclei, the structures that leave are called the internal arcuate fibers. They cross in the ventral part of the medulla as a structure called the great sensory decussation. The what? Great sensory decussation, and continue on as a flattened band known as the medial lemniscus. As a flattened band known as the medial lemniscus. Rana, you're there? Okay. To which nucleus of the thalamus does this structure project to? So to which nucleus of the thalamus does this structure
The
project?
important stuff for
But it
there.
wouldn't be
Man in the yellow shirt.
Krishna.
VPL. His name is Krishna?
Krishna.
Very good. VPL. Very good. VPL. Ventral posterior lateral nucleus.
Who goes to
Okay.
the
Ventral posterior lateral nucleus.
Solitary.
The thalamic nuclei project to which layer of the cortex? Man is hot in Neuroanatomy. He's very hot. He is very hot.
Goes to layer 4 of the cortex.
Goes to what? Layer 4. That's the receptive layer. Very good. And the output layer is layer 5. Very good. The Man is on the ball. What's the innermost layer called? Innermost layer called? Multiform. Outermost layer is known as what? Molecular. Alright. Relax. But that was very good. Alright, relax. Let's do some very important things. Alright. Okay. Alright. This question is to a man by the name of Corey. Corey, what does it mean?
Why does it sound so dry?
Lamina terminalis.
Lamina terminalis. What did he say? Lamina terminalis. Is that a good answer?
No.
No, it's at that
And look how big it is here. No,
that
Corey,
the-
can't let me down.
median amount.
Look how big it is here.
What are you talking about?
I've never
Pituitary
seen it
stuff?
so
What
big.
are you talking about?
Is it tubers?
A lot of.
Oh, that's the infundibulum.
This is large.
No, that was the thing in front of me. There's an X thing. That was awesome. Tuber scenario. What else? That sounds like shit.
It's just my opinion.
What is that though?
That's where the pituitary stuff is.
Yeah.
Yes, sir?
This is how everything in dances are later.
Who were we asking originally?
Corey,
Corey, you
yes,
have the answer now? So Mike, where is it here? Mike, here.
Good answer. Yeah, man.
Simply one more diagram. Very good. So watch here. So look here. So what? These are the optic what? Nerves. Right? This is optic chiasma. That's the optic nerve. That's optic chiasma. Then comes back as a what? Optic tract, which you can see on that specimen. Beautiful. Then the optic tract meets a thing called the cerebral peduncle. Alright? Which is then going to do business with the pons. Reasonable? So that space is called interpeduncular fossa. A space which is bounded anteriorly by the optic chiasma, anterolaterally by the optic tract, posterolaterally by the cerebral peduncle or crus cerebri, posteriorly by the pons. What's the immediate posterior relation of the optic chiasma? The infundibulum. And what's the elevated area right around the infundibulum called? Median eminence. Then the land which is further out here called tuber cinereum. That's the pin is in the tuber cinereum. And then back here now these are called what? Mammillary bodies. And then back here is called what? Posterior perforated substance. And then leaving here is cranial nerve what? 3. Very good. Very, very good. Alright. Where are we? Where are we?
So, good.
Alright. Let's move on. Okay? Alright. No. What I'm wanting to look for. Alright. Or look where the pin has been in all the time. Watch here. Let's just put the pin there where the hole is. Right there. And this question is to a lady named Danielle. There. See exactly where it is. So always the pin is in there. So this is another thing that comes in every exam. So Shani, that comes in every.
See real quick?
So what are you looking at here? An elevation. What you are looking at, Shani? An elevation, another bump. And that elevation is known as what? Facial colliculus, formed by
Facial nerve and neuroanatomy.
facial nerve going around the accusains. So that structure is the what? Facial colliculus. Very good. Alright, relax. Look at this. See how many times this has been asked? Look here. Look at it. You see how many times the pin has been in the mammillary body? Look at it. There again. There. Alright. So there's a mammillary body. So that one has a beautiful what? Tuber cinereum. Alright, and there is the mammillary body. Alright, no. Simpson. There's a nerve right here. What nerve is that resting on the pin? There. Hmm?
That's pyramidal.
Yes, so this is between the what? That's it between the pons and the pyramid. So that is cranial nerve. 6. And 6 tends to run that way. 7 is going that way to the internal acoustic meatus. Right? 7 is going to the internal acoustic meatus. So that one that travels forward is cranial nerve 6. And there, this is beautiful. Alright, this is really nice. Okay. So Miss Simpson, who is resting on the pin? Which cranial nerve? Look at the diagram. Look at that diagram, this one. 3. That is cranial nerve 3, arising from the medial aspect of the cus cerebri. Arising from where? The medial aspect of the cus cerebri.
So you can turn it around.
In the exam, in every exam, somewhere down around there, in neuro exam, there's a question on the mesencephalic nucleus of the trigeminal. Alright, so it comes in some form or another. The mesencephalic nucleus of the trigeminal. Okay, involved with which sensory modality?
Proprioception.
Proprioception. So proprioception goes to the mesencephalic nucleus of the trigeminal. Well, let's do something here. Andrew Lee, what pin is, where is the pin? There. Where is the pin? You can get help from Ibrahim. Is that help?
Yeah.
Ibrahim, what's that guy to your left doing? What's his name?
Julian.
Go ahead. Julian. What's the pin in? Medial frontal gyrus. Very good. Functionally, what is this area known as? Supplementary motor cortex. This area is known as what? Supplementary motor cortex. So you have primary motor, premotor, and over on the other side is supplementary motor. Alright? Okay. Very good. Alright? And all of that, no, that is the what?
Singular.
That is the singular. Alright. No, just doing some basic things. Very basic, no. Nothing too hard. Just some very basic things. Here. Just very basic. Nothing very hard. Alright. These 3 pins. Julian, 3 pins.
Cuneus.
Cuneus, which is cuneus?
Answer the purple pin. No, this one is pre.
Cuneus?
Is pre-cuneus.
No.
That's wrong? Okay. Whoops.
No,
But that's definitely
you
cuneus.
see? Hold on. Listen to me.
Oh, the lingula.
Okay.
Oh, it's at the tongue. Okay, lingual gyre. Lingula.
Lingular or lingual. Okay, which one? So it looks like a what? A tongue. And which sulcus is this?
Calcarine.
Calcarine. Right? Calcarine. Receiving input from where? Receiving input from which nucleus of the thalamus?
LGB.
LGB. From LGB. This is getting, and this is Brodmann area what? 17. And we're coming out to the tip here, this is area what?
18.
Alright, going area 19. Alright, 17. So these are called the banks of the calcarine sulcus. Alright? And about a third of it is receiving input from where? The macula.
Okay.
Right? And the macula is really just a little dot on the retina. Okay, just a little dot. But a third of it is going to the what? To this. Alright? Okay? A third of it. So it's amplified at the level, or the macula is amplified at the level of the cortex. Okay? This area is known as the cuneus, and this area is the precuneus. Now, there's a lady here by the name of Miss Allen. Miss Allen, what's the arterial blood supply to the precuneus?
To the precuneus. Middle cerebral, I'd say.
I don't know.
Posterior don't go so far.
I don't know. Precuneus, what's the blood supply to the precuneus? Miss Allen, to the precuneus. What's the arterial blood supply? Let's take out the other things. But they don't distract. So what's the arterial blood supply to the precuneus?
Throwing a lifeline. Posterior cerebral, I think.
Shani, what's the blood supply to the precuneus? Yes, so the whole of this surface is anterior cerebral. Remember, anterior cerebral supplies all around here. Goes over here. This is all what? Anterior cerebral. And then when it reaches parietal occipital lobe, it's now in the area of occipital lobe. So that's posterior cerebral. Reasonable? Very good. What's an important afferent to this structure?
Superior curriculum.
Only one man knows.
Superior
Who is that
brachium.
man? Jehu. Mitchell. Very good. One man alone. Well, Mike may know also.
Say the superior brachium. Is that it?
You think we should ask Mike first?
Ask Mike, yes, ask
Yes.
Mike.
Mike, today, superior colliculus. The inferior colliculus we all know. That's lateral lemniscus. What about the superior colliculus now? So where's superior colliculus getting from? And Mike is not a guy to let you down. You know that, Sean? He will not let you down. Never. LGB. Yes, very good.
Superior
Yes.
brachium.
Through the superior brachium. Very good. And there's spinotectal tracts going there too.
But it's the most important.
So that you can, if you
Move your head.
move the head towards where, yes, you know. Alright, so
Just to clarify,
spinotectal.
you said most.
Right, very good. Reasonable. But it's really coming primarily from this. So what's basically happening is that optic tract comes and optic tract sees LGB, and some fibers that the fibers that are going to the visual cortex synapse in LGB and move on to the what? To the visual cortex. However, some fibers really don't do business with LGB and now go into the superior brachium and end at the superior colliculus and the pretectal nuclei. Isn't that so? For consensual and light reflex, okay, and various things.
Run, Coombs, run.
Okay. So the fibers that are really there are from the superior brachium. Okay? From the superior brachium. Very good. Excellent. Alright. No, there's something that's begging to be asked. As I see that specimen, I'm wondering now which one has it on it. Okay, think. Looking. That's it. Maybe this has it. This has it. Very good. So remember we looked at the. Remember we were looking at the what? At the. What were we looking at? This is my name. No, Andrew is not going to let me know. Andrew won't let me know. All right. This boy right here. Andrew came in late. Very good. No problem with that. Andrew, what is this here? Let's give it to him. This is one. Let's give Andrew this. But before we send it over, we have to ask Miss Simpson to identify that structure. So Miss Simpson, you must have to identify what the blue pin is in. The red pin is for Andrew. What's the blue pin in?
Where's the dryer brush?
Rashika knows you know. Where Rashika? Pulvinar. That is it? Pulvinar. Okay? Pulvinar receives connections with what? As you think of pulvinar, what does it have connections with? Which thalamic nuclei? LGB and MGB. LGB and MGB. Very good. Alright, wait. There's a big, massive cranial nerve coming off right here. Look at it here. See it right here? Massive. Big thing, like a brush. Like a little paintbrush. What nerve is that? Trigeminal. Okay? So Andrew, this question is for you. See if you can remember what that is. Alright. Let's move on while Andrew works on that one. Or so you have other specimens. Very good. Let's do some cerebellum. Cerebellum is always in the exam. Alright? Okay. Very good. Is it getting too late?
I'm all good.
No. Alright. Well, let's ask an easy one, or we're not asking anything hard. Let's just keep it nice. Very good. So, very good. So, Shani, which cranial nerve emerges right here? There. You look and see where that pin is in. That pin is in between two elevations. One is the pyramid and the other is the olive. So that is cranial nerve 12. 12 is between the pyramid and the olive. 12 is between the pyramid and the olive. And then 9, 10 and 11 are retroolivary. 9, 10 and 11 are retroolivary. Very good. Alright, so that is in cranial nerve 12. Right? Now, if that cranial nerve is 12 is affected, the tongue, when you stick out the tongue, it deviates to which side?
Affected side.
To the affected side. Very good. Deviates to the affected side. Very good.
IMP.
Very good. Alright, now, let's do some cerebellum. Alright. So, Andrew, we've worked out that thing good? Ibrahim can help, give some help, assistance, you know. He's a good friend. Alright. Very good. So there, let's use, where's the red pin? Where's that red pin we had it? The big one. This, very good. Alright, we'll get back to this now. Come, cerebellum now. Cerebellum time. There. Okay, so this is now to Deandro, main afferents.
That is in paravermal.
Yes.
So the main afferent. For posture.
For posture, what else? Muscle tone and reflexes. For what? Posture, muscle tone and reflexes. Very good. So
So the main afferent would be the anterior and posterior spinal cervical.
what else?
The cuneo cervical.
So Jonathan, you have a good student, you know. She's hot. Jonathan's personal student. Very good. Very good. She's good, you know. Very good. He's traveling high. He's on an 80% level. He's hot. Very good. So anterior spinocerebellar, posterior spinocerebellar, cuneo-cerebellar, and olivocerebellar. Very good. And the sense and what sensory modality is conveyed to that part of the cerebellum? Leandro, what sensory modality? Proprioception. Very good. And the anterior and posterior spinocerebellar tracts have their tract cells located where? Clark's skull.
Sir.
At which vertebral levels? Right, C8 to about L2. Just exactly like the sympathetic, the lateral gray horn.
Sir.
Yes.
Don't the ventral spinocerebellar come from spinal border cells? Something like that? The dorsal come from Clark's column and the ventral come from the spinal border cells.
Well, yeah, they have some theory, but for the exam, no, I follow what you're saying. But for the exam, it will be just Clark's column. Very good. But that's a good point. All right. And then now, knee, main afferent pathway here. Very good. Hot. Transverse pontocerebellum from the pontine nuclei. Transverse pontocerebellum. As I say transverse pontocerebellum, immediately every exam has cerebral peduncle. Every exam has in it the cerebral peduncle. Okay? Very good. I was asking something on this. I never did ask it. Remember I picked it up? And then we went somewhere else. Okay? No. So the pin now is, so I know as I put it in Jonathan is on it. So, Andrew, we got all that thing yet? You identified it? Where is the specimen? Decussation of the what? Superior cerebellar peduncle. That is decussation of the superior cerebellar peduncles. Alright? So all you need to do is what? Look at a brain atlas. Just look at the labels. Just go over them. Alright? Go over them. That's all. Just look at the brain atlas. In fact, in the first lecture, introductory lecture, I gave a lot of whole heap of brain slices earlier. Everything is labeled. So just go through them. That's all. No big thing. Alright. Where are we? Sandro, just go through that lecture and see the thing. Alright? Now, Ibrahim, where are we?
Third ventricle. Yes. In the third ventricle.
Yeah.
No, what's the pointer in?
Is that the apennular commission?
I don't know.
Interthalamic?
Posterior commissure. See, it's big.
Oh wow.
Big. So that's a massive one. That's the posterior commissure. And also this book is very good, you know. It has a lot of good brains. In fact, I think it might be out of that book that I got those sections. Yeah, that's very, very good. This one is hot. Does yours need?
Yeah, I just got it.
Yeah, it's very good.
You just get that?
It's very good.
Okay, look at that old.
So this is the what? The posterior commissure. Nothing wrong with that. Connects what? Pretectal nuclei. The what? Pretectal nuclei. Okay, very, very good. That's the posterior commissure. Alright, let's look at a couple more things here now. Okay. Now, there's a man here by the name of Ibrahim. Ibrahim, main afferent.
1.5.
Main afferent. Main afferent. Deandra, what you see? She's hot. Vestibulocerebellar. Function? Balance.
The Andra. Too crucial. Too
Very
crucial.
good. So Leandra seems to like her neuro a lot, you know, Julian.
You should like
She used to sit right here in the tutorial. Right there. And I observed that she was very good with what? Her neuro. She seems to like it a lot.
It's going to be.
Very good. Excellent. All right. Very good. So Leandro, so that's very good, you hear? All right. She has a good neuroanatomy base.
It's good.
We're going to think like neurology. Right. Because no neurology. There are many neurosurgeons, but in Jamaica there are next to no neurologists. There are only, maybe you can count them, not even on one hand. There's just a couple little few of them.